to make sure that they know that we have their best interests in mind. And if we don't take the time to get to know who they are and what's important to them, it's really hard for us to meet their needs. So we really want to expand our knowledge, and we want to improve our competency. And if we don't have that right knowledge, it's okay to go and ask for help and get additional resources. We really want to care for our patients' most basic of needs. And so it's really important that hair and skin care, we need to look at it as it relates to different ethnicities. All right, can you turn the page? So, when I first came into this topic, it was when I was teaching a course with, it was the fundamentals course, and I was teaching the students about how we were going to be assessing the head. We wanted to assess the head and feel the scalp. We wanted to be able to feel the lumpy, bumpy, you know, the occiput. We wanted to make sure that their, you know, hair, we wanted to feel if it was dry or greasy, or you wanted to really get in there and get to know, you know, what a normal healthy head looks like. Because if you have a patient that comes in with a contusion or some other issue, you know, if you don't know what a normal head looks like, it's going to be really hard for you to determine what is abnormal. So after I was taking care of this class, one of my students came up to me and said, you know, it's going to be really important if you let your students know that you're going to be touching their head and their hair. And I was a little confused. I didn't understand why she was, you know, bringing this up to me. And she said, because it can be really embarrassing, you know, if somebody is touching their head, and, you know, it's a cultural thing. And so I was just like, thank you for her for letting me know that. But I was still a little bit confused. So I went and talked to a friend, and I tried to get some more information. And that's how I got started on this topic. I just didn't realize that I was teaching a course, and I was teaching people how to take care of people's basic health and their basic hygiene, and I was missing something. The next thing that came to my attention was I was reading a book. It was from one of my favorite authors, Judy Picoult. And it's this book about, it was a Black nurse who was a labor and delivery nurse who delivered on the floor that she works on. And when, after she delivered her baby, she said, you know, the sweat that mats the hair of all my white patients to their forehead instead makes my hair curl up en route and pull away from my scalp, brushing my hair around my head like a swirl of ice cream cone, and wrapping it in a scarf each night would keep it straight for the next day. But what white nurse would know that or understand that the little complimentary bottle of shampoo provided by the Hospital Auxiliary League would only make my hair even frizzier? And perhaps I stopped and thought about that because I had just been thinking about this topic with my students, and I thought I had never realized that that would be a problem where using that shampoo, it never occurred to me. So it sent me asking more questions, and that's when I got a hold of Jamice, and I'm like, okay, I just need to ask some questions because I don't know. I just need to know more. And she helped me look into these topics. I just want to make sure that the next generation of nurses can meet our patients' needs in a culturally competent way. It's one of the most basic of needs of our patients, and I just want to make sure that we meet that. Go to the
Can I say something, Professor Haggarty?
Sure, of course.
Those of us who have been in this field for a long time, this has been something that has been neglected from people of color, that has been in facilities to where I know me personally, because that's all that they give them is shampoo and conditioner. And Black people hair, you have to have some type of moisturizer, you have to have some type of grease for the scalp so it wouldn't get dry. So a lot of aides, we used to actually bring in our own hygienes for our Black patients because the facilities, they never provided it. And it goes both ways. people of color, they don't know how to take care of Caucasian people hair neither. You know, I had a black girl, a black egg that put pink oil moisturizer in a white, you in the white resident's hair because she said that her scalp, you know, that her scalp, that it was, she had an itchy, dry scalp. So she wanted to put, you know, pink oil moisturizer in her hair. So that was a huge in-service, but they never got the picture that everybody needs in-service. And I'm just like you said, different cultures calls for different priorities, you know, of skincare, hair care, and even nail care sometimes.
Right. You know, I can remember every time I would go to the long-term care with my students, I would say, you know, I'd always want to make sure we bathe our patients. I want to make sure that we spend time with them and we pamper them and take care of them. So I always would encourage them to bathe and clean up their residence. And it never occurred to me that we could be stripping the oils from our patients' hair and actually damaging it and hurting them. So I think this, you know, our goals is to educate on basic care and hygiene and skin. We want to understand the significance and self-esteem related to hair and skin care. We want to examine the basic hygiene and moisture needs of hair and discuss how often and what kind of care is necessary for routine care. You know, and I just think this is so important. I mean, when I would go to the long-term care facilities and we'd have these elderly African-American women with, you know, alopecia, and their scalps are so dry, and it never occurred to me it was possibly because of the care we were giving that was causing this issue. Erin, if you could go to the next slide, please. So we know that there's not one right way to care for everybody's hair and skin. In nursing school, we teach one right way to do this. And I had not realized that in doing this, we're really limiting, you know, what we're teaching the students, that there's just so many things that we don't know. And I'm so thankful to have that student who helped me on this journey to help me to realize that we need to expand our competency of knowing what we need to do for these patients. The incorrect care can be damaging and harmful and could be causing permanent damage or breakage to our hair loss. I also put on here that, you know, up to 13.4% of our population are Black African-American, and 2.8% say there are 2 or more races. So we do have a large population, and in some areas even, you know, higher populations in your facilities that need this special care that we need to educate everyone on so that we can meet the needs of our patients. And it is vital that we teach our nurses how to culturally meet their most basic hygiene needs. We do talk to our students a lot about, you know, cultural, you know, like some cultures want to bathe in the morning, some want to bathe at night, some only on certain days. Some cultures only want the same-sex caregiver to take care of them. I mean, there's just many different cultural things that we do teach our patients or our students, but this is something that I think has been missing. All right, I am going to hand it off to the very willing and capable hands of Jamice, because I've learned so much from her, and I hope that you can learn something from her as well.
Hi guys, thank you again for coming.
Hey Jamice.
Hi. Okay, so I'm gonna go a little more in depth into what Kristine has already talked about. So I was explaining to her that just like I like to say Caucasian. So just like the individuals that are Caucasian, they have different types of hair types. So do we. African Americans, Black Americans, however you would like to be addressed, we all have different types of hair as well. And then this picture here, this kind of gives you an idea if you don't have any experience with what we like to call our curly kinky hair, there are different types of curls. So even with that, that makes it even more complicated on how to understand how to care for our hair. And even when I was explaining to her, I have very tight coil curls when my hair's not braided and my hair's out. I have tight coil curls, but my hair is very soft and my hair is very fine. So if you're really rough on my hair, you could actually damage my hair. So what I was explaining to her was even simple things on how we maintain with not just washing, it's a whole process for us, especially if you care for your hair on a regular basis and keep your hair healthy. It's not, I wash my hair, and I was explaining to her, how this actually started with me involved is she actually called me up and she was like, can I ask you a personal question? She called me, she goes, if you were at work and someone vomited and it got in your hair, would you use the shampoo at work? And I was like, no, I'd have to go home. I was like, I would have to go home. I actually wear wraps on my hair at work. I actually wear like a bandana, and that's why I usually keep my hair braided because I am a nurse as myself. I work in the ICU, so I'm around bodily fluids all the time. And I keep something over my hair for that reason, because if I had to have something like any body fluids got in my hair, no, I would not be able to use the shampoo that they offer in the hospital, not in long-term care facilities, no, because a lot of that is a 2-in-1 that they usually offer. It's like a conditioner / shampoo, but what is most important is that there's alcohol in a lot of the shampoos that Caucasians use. And I'll tell you the difference in why in their hair and ours. So if you notice, a lot of Caucasians will typically not wash their hair every day. Some, I'm not saying all, but some won't because they will, wash their hair every day because their hair builds so much oil. Their hair naturally builds up oil, and our shafts are different than their shafts. So our shafts, because it's curly, we do produce oil in our hair, but the reason why it is drier is because it has to come down the coil of the curl. So our hair dries faster. With someone who has straight hair, it is easy for the oil to come down the shaft even faster. So that's why typically when you're Caucasian, you would wash your hair more often, because your hair will have more buildup of oil faster than our hair would. So that's why we don't use shampoos with alcohol in it, because it would be stripping the little oils that our hair naturally actually produce. We actually have to add more, as you were saying, is it Jabbar? I hope I said your name right. As he stated earlier, we do need to use more products that have more oils or moisturizer in them, because we need to be able to moisturize and keep that natural oil in your hair. And to understand another concept of what I'm saying is the difference in using body wash and using a bar soap. Your skin feels a lot different when you use body wash than you would use a bar soap. Bar soap, your skin feels like squeaky clean, versus like if you use a body wash. Body wash typically has moisturizer in it. That's why it feels different when you come out. That's the same concept in how we care for our hair. So this is just to give you guys a quick little idea. Excuse me, mouth. I'm sorry. This is just to give you guys a quick idea of the different curls you see every day. And that's why when you see all shades of African Americans and how we look and our color and everything, that's why we also have different shades, different curl patterns in our hair as well. I'm ready for the next slide. Thank you. The same thing with skin type. And I actually was talking to someone about this ironically today. There's also the assumption of our skin tone on basically and how much African is in if we are African American, because we have all kinds of Black Americans here. There's people that are Haitian, there's people that are from Trinidad, there's people from Jamaica. So they're not technically African Americans, they are actually technically Black Americans, because they don't have necessarily African descent, they have their own form of African descent. So with that being said, we all have different types of skin color and skin tones and how our skin absorbs. And as you can see on the chart, just to give you an idea on looking at the water content and how our skin absorbs oils. So typically when you're taking care of an African-American patient or a Black American patient, their skin is going to need more oil. Our skin needs to have more moisturizer on it. So when you bathe the patients with the soap that is like usually brought in from the facility, again, it probably has some type of alcohol. Well, when you're stripping our skin like that, you're taking away the natural oils from our skin. That is also why our skin typically doesn't wrinkle as fast as well, because our skin needs to keep a lot of the oils in. And it has more information, which that's another rabbit hole going down there for information. If you want more information of why specifically from different shades and cultures of why our skin behaves different, I would be happy to go further into that, but we will be here for a very long time because that's a lot of information. But with our skin, just understand that when you're dealing with a patient that is African-American, understand that when you bathe them, please lotion them afterwards. Do not let them lay there and air dry. That is why when you walk in, their skin is probably flaking. That's why their skin is like dry, or I commonly hear people say ashy, but I just hope everybody knows every race can be ashy. But that is what you're seeing, is that you're stripping, again, oils from their skin, and their skin needs to have that. And if there's a nice little scale for you guys to kind of see the different types of skin tones and how, like again, how our skin is a lot different. If you look at the plus signs, there's a drastic difference in Black skin compared to when you're looking at Caucasian and Asian skin. And then
can I say something real quick on this? I'm just a nursing student, whatnot, but just, I am a licensed esthetician, and I've spent my entire professional career before moving into nursing in the salon and spa industry. And this whole conversation hits so different for me, because everything you're saying, I'm like, everyone needs moisture in. Everyone needs oil. Like you say, like, oh, they're using alcohols. And I'm like, they shouldn't be using them either. Like, no one should be using them. Like,
I do agree with you there. That is very
true. I love
true.
This conversation.
But the way, I would say that the way that the alcohol responds to African-American skin is completely different in how it totally responds.
Different. It shouldn't
like,
even
especially if you, I don't know if you still do it, but I would just say if you ever had some willing participants, I would literally just do the same, like use products that you definitely would not tell your anybody that's African-American or that's Caucasian. Literally do the same thing and watch how the skin responds. The skin is completely different. So yes, all my patients, trust me, and anybody that's been a CNA or a nurse, we've walked into very dry skin on all races, and we all pretty much have moisturized everyone. But this is just to educate, because sometimes I'm pretty sure all of us have seen that either coworkers or ourselves who are uneducated on how everyone's skin is different in their hair. This is to educate those that when they're out there, the natural thing is you want to care for your patient. You want to go in there, you grab the shampoo, they need their hair washed, it's their shower day, blah, blah, blah. You will damage someone who is African-American, you will damage their hair. Especially like I work in the ICU, people lay in beds for days, sometimes months. And a lot of times these nurses are truly being kind, just wanting to go in and help their patient, and they're African-American. And then they're coming to me and they're like, their hair's falling out. And I'm like, what have you been doing to it? And they're telling me that they're using the shampoo that we have in our stock. And I'm like, that's why their hair is falling out. Our hair is not meant to do that. And so you have to remember, the same way you would treat your skin on your body is the same way with their scalp, is the same way. And a lot of people don't really defend, like they don't understand that that's something that they should keep in mind, that you would never do all these harsh things, use harsh chemicals on your skin when you're washing your hands or washing your body. You have to think of your scalp as the same thing. That is another part of your scalp is skin. So the same thing needs to be addressed. So this is what we're here for them to know. We do extensively, and you'll see in your education as a nursing student, they will extensively go over basic care, but this is an opportunity for us to expand so that we can see, because we're talking mostly about African-Americans because I am African-American. So I can give a little bit of an experience of myself and my family, but I definitely would not be able to be on here if I was Asian in explaining into depth of how they have, because I'm pretty sure that I know for a fact at least Hispanics have different ways that they feel how they care for themselves, and the same thing with Asians. But this was an opportunity that Kristine and I saw, that she didn't realize that we are teaching one way. And if you look at on how America works right now, we were never, like, a lot of different cultures are not part of the norm. And right now, what we want to do, because Herzing is such a great university, and their program, especially nursing program, is amazing. We like to make sure that we are ahead of the game, that we know more, that we do better when we step out of there. And so this is our objective here, is to educate, so that when you guys walk out of the door, you will be better than the next nurse when you walk through the door. You will have better education, that you'll take pride in knowing that you know how to properly care for someone who doesn't look like you. We talk about cultural competence, but it's what we're showing here is that how we need to implement that better into our education. So that's what we're doing here today.
Yeah.
Yeah, and I totally understand that, because it's like the way that you all are teaching is this is way before that we were so much more culturally diverse now, you know, to where just like you can still go by the regular BMI, and we know that nobody 6 foot should weigh 170 pounds. Be serious. But that's the old aspect of nursing, the same with the skin, you know, the same with the skin and the hair care. So I do like that in Herzing, as far as that they're stepping the game up, as far as making sure that everybody's culturally competent as far as what's going on.
Yes, that's definitely our objective.
Absolutely.
Okay, I'm gonna move on to the next slide. The basic care. So this here is just us, just to give you, like, if anybody was actually following each of our slides here, just letting you know, I went already in depth about moisturizing, so we can move on, because I'm not going to beat the horse. How is it? I don't know the saying, but you guys know what I'm talking about. Okay, protective styles. So this is something that also relates to what Kristine was saying. So her student was African-American, right? Who came to her, and I don't know if any of you have been through a health assessment yet, or have had it, but you know that we do a head to toe. And so when she was explaining that we were going to go through the process, when she was going over the head aspect, and how you're going to look at the face, look at the ears, look at the head, look at the skin, the quality, those are things, and touch the scalp and get very hands-on. Herzing is very hands-on with their teaching. So what the student, to elaborate on what Kristine was saying, is the student was explaining to her, if that is something that is norm, that should be something that you should say up front. And this is what I had to explain to her, is I said she probably had a protective style in, and she didn't want everybody rubbing all on her style. And she said, what do you mean? And I explained, so I went in, because and I'm only giggling because I love that Kristine is that she's open and wants to learn, because that is something that's important when you have someone teaching you, the fact that they're open to learn and work with you to learn together. So what a protective style is that, like I said, so wintertime, it's wintertime right now. This is a protective style that I have, and I have braids in my hair. So this here is protecting my natural hair, because for me, this is a very drying time for my hair. Very drying. When I say dry, it makes my hair very brittle. I can moisturize for hours, sit under a heat, like put moisturizer in my hair. I could sit under, what is that called? I cannot think of it. A dryer. Let's sit under the dryer for hours and my hair will still be dry. So to protect my hair, I put in styles. So that could be braids, that could be wigs, that could be crochet braids. People still do glue-ins, sew-ins. Those are where we add in additional hair, so that when we're out in the environment is destroying the protection that I've put in my hair versus destroying my hair. So when she was explaining when the student was explaining that is important, as you can see in the picture with the wig, so that's what we would call a lace front. And basically, if you wanted to really know what my scalp was, you would not know with that on. That's not my scalp. I put a wig over my scalp. So if someone's going to be rubbing in my hair, 2 reasons I will say this. One, a common thing, and I'm not the face for my race, so I'm just going to speak for myself. For me, when I've spent hours in getting my hair done, I don't want to feel like I'm at a petting zoo. So a lot of times people get interested and want to know about your hair, and the first thing they want to do is touch. And I'm like, I just spent 8 hours getting my hair done. I would respectively like not someone to play in my hair like that. So I think what she was trying to explain was that if that is something you want us to do, then she can arrange, like she could have got her hair braided. So it's a little bit easier for you to rub all in her hair and look at her scalp, but versus me putting on a wig. I don't want you moving it around, because there's different ways that, we put in our protective styles. Sometimes it is an entire wig. Sometimes it could be just the top. Sometimes it could just be sew-ins. There's different ways that we add in hair. So it would make it very difficult and very uncomfortable, if that's not something you're sharing with someone, for them to rub their hands in there and they can feel your hair, because there's a lot of beauty things that women do, but we don't always showcase out to everyone that what we do. And it's the same thing for African-American women. This is something they do for their beauty or their health of their hair. And so the proper thing to do is what I will tell you. The last time we did this, is the story that I gave us what I mean by understanding their hair. So a patient came in, she was obtunded, meaning that she was incoherent, was not able to speak. And she had what we call tracks. So she had glue-ins. Her hair was glued into her. There was like tracks of hair. That's what they call them, tracks. It's tracks of hair. So it's hair that lays on a track. And they had it in her hair and it was glued. Well, we had to end up running continuous EEG, and that's when we're basically monitoring their brain continuously. And in order to glue on the different prongs there, you have to pretty much glue it to their scalp for it to read properly. Well, the nurse knew that she had influence, so she removed them out of her hair so that she could get it. The part that I felt was disrespectful to the patient was they washed her hair and then she hung it up in the room like a towel and to let it air dry. That was, I felt so bad. I'm so glad during that time it was COVID, because family is not around as often, but to understand how that's like taking someone's underwear, washing it and hanging it up in the middle of the room for everyone to see it drying. That's how it would make me feel. If you took my hair, because anybody can have an opinion about how, if it's my hair, not if I paid for it, it's mine. If you take that out of my head and you wash it and then you hang it up in the middle of the room, that to me is very disrespectful. And to respect a patient and their choices, just like if I can't even think of anything that we do as a woman. I don't know. Maybe she had like a ring in. I don't know, like the birth control ring. You wouldn't wash her ring and then hang it up to dry, because that's just, we would think that's inappropriate. That is the same concept that I want to lay across for everyone today, that you would want to think about when you're dealing with an African-American patient that has hair. Don't leave their hair out. Don't toss their wig just anywhere. That is a piece of them. That is something that they use to make them feel good. So wash it, put away in their bag, and then just let their family know if they want to take it with, or if they want to put it in their belongings bag. But don't hang their hair out to dry like that. That's very embarrassing. And the nurse that I was dealing with that day, I spoke to her and she wasn't meaning to, she didn't know. I mean, that's not her culture, but I rather that if you're dealing with something that is not part of your culture, it is wise to be kind when you walk up to someone that is that culture, but just say, I'm very uneducated about this topic. My patient has this. How do I do this the proper way? That's the best thing you could do. So this is something what the education of the protective styles that I wanted to elaborate on, because I just wanted to make sure that everyone understands when you're dealing with patients in all facets, doesn't matter where you go after you graduate, if you already graduated and you're here on here, just remember when you're dealing with those patients, that remember that this is something that is meaningful to them, and you don't know how their family may feel when they walk in and see their hair just sitting out there airing, drying, like it's a towel. I'm ready for the next one, Erin. Oh, my favorite. Oh, okay, CHG baths. Okay, so I know in my work setting that we use this a lot, because in the ICU, we give you these baths every day because we don't want you to end up with MRSA and other things like that. understand that I wouldn't do it right away because then you won't let the CHG work. But when you're giving a patient that is African-American this bath, it is drying to their skin. And you will cause them to start drying up very fast. You will cause their skin to like crack and become very, very fragile. So after you give a patient a CHG bath, I would make sure that later on, go back, give them a nice little rub down with some lotion because their skin is going to be dry. Because CHG is the best way to explain it. It is a very powerful alcohol, basically. I mean, obviously there's more to it, but the best way to put it in layman's terms, it is a very strong alcohol and that will dry out anyone's skin. So make sure that you go back and you later on after it's dried on their skin, go back and lotion them up because you will damage their skin really bad. And then the shampoo cap. Don't use those on African-Americans, please. Those caps are not good. Kristine and I went back and forth, like going, because she had questions and I was explaining, I would never put that shampoo cap that's in the warmer on anybody that's African-American. I would never put that on their hair because again, a lot of the product that's sitting inside of that is full of alcohol and it would dry out their hair. It would make their ends very brittle. So I know I don't have a picture of it, but I don't know if any of you have ever seen it, but it's like, it looks like a similar bag to the picture here that we have on the screen, but it has like a shower cap on there. I would, like Jamar said earlier, which is funny because I had told her that when we first got started, I said when I was an aide, we actually would put our money together and we created a hair care drawer. And we actually went out of our way and bought all of the products for all of our different cultured patients so that we were able to make sure that we could accommodate to all of them and make sure that we gave them the best quality care that they could have, knowing that everyone in our facility was not the same. And then we can go to the next one.
Sorry, I actually had a follow-up question on that. So
yeah,
if for some reason, there aren't any products that are available on your floor for you to use, do you have like a quick fix for something that, they can do to make it more appropriate for them to use it or?
Yeah, I mean, I run into that all the time because now I work in a level 1 hospital. And so I work in 5 different ICUs. I don't have like a home. I'm resource pool. So it's harder for me to bring product to work. So my go-to is take the shampoo and then I grab the baby oil and I put a little bit of the baby oil in there and I will wash their hair that way. And then when I come back from washing and rinsing their hair, I'll put a little baby oil in my hands and I'll rub it through the patient's hair. But I typically, that's just me. I'm not asking everybody to do that. But then I would go back and braid my patient's hair so that I could seal in the moisture a little bit better so that their hair won't be dried out from the shampoo I just used.
All right.
I want to add also, if you don't have baby oil, you can also, if they have like this little small things of Vaseline or the petroleum jelly, that's
Correct.
better than nothing.
Mm-hmm. Okay, so basically, Kristine and I, our takeaway from this is, we love acronyms at Herzing. So it's LE.A.R.N. So I hope you guys were listening to everything we were saying and listen to your patients. Listen to their families. Sometimes our patients, especially in my world, it's hard for me to listen to a patient when they're intubated and sedated. So it's easier for me to listen to their family and hear what they normally do, how often they cared for their hair. Because even me being African-American doesn't mean I know how every African-American likes their hair to be done or how they treat their hair. So I still ask questions. I want to know how they care for their hair because I want to be treated the same way as if I was healthy. My hands are like my health is in your hands. So I would want the same care. And that's how I try to walk into work every day. I don't know everything. I know I don't ever know everything, but questioning and listening is a big thing. E for explain when you're like, I didn't really go into a story before, but one of my coworkers have come to me before about questions, just like you asked me, Erin. Literally, she asked me like, I don't have any other shampoo. What do I do? And I told her, I was like, use the baby oil. And like he said, if they didn't have baby oil, then we use the petroleum jelly and you just kind of mix it up into a little graduate and then you can go in there and wash their hair. Just explain what I felt was so appropriate, the way Kristine came to me, the way my coworker came to me. The thing is how they explain their perception of something they don't understand. So when she asked me questions, it wasn't like, well, why do Black people do this? I think they were very tactful. It was like, I'm very ignorant to this. I had no idea. Is this true? Can you elaborate more? Tell me more. That's the best way to reach out and ask, because like I said, I don't know everything about every other culture, and I'm always asking questions because I want to understand. I want to make sure that you'll be surprised, touching someone on their shoulder in another culture could be completely disrespectful. Things that you think are normal are not normal for everybody. And the more you work in nursing, you will deal with all kinds of people that you have never ever. I've never had anybody that was Laotian, and I've had several Laotian patients in the last couple of years. I thought that was very interesting to me because I don't know anything. I don't know how they speak. I don't know anything about their culture. But what I did was I explained my ignorance, and I explained for them to tell me more so that I could properly care for their mother, because I didn't know anything about their culture. So explain yourself. A is for acknowledge and discuss the differences, because sometimes the smallest things that we do different, there may be something and one thing out of something that we do different that will make us see some similarities. So, just learn from each other, talking. That's something I hope we really learn, especially the year that we had last year. Learn to listen and acknowledge everyone and learn from each other. There's so much we can learn from each other. R is for recommend. If you are part of that culture and there's something that help your coworkers out, help your patient out, recommend things that that works in your own culture, so that maybe they don't know about it, then you can tell them about it. I mean, I know for me, I still learn things about my hair that I didn't even know about, that I learned from individuals that are in my culture that they've been doing with their hair for years. So you can always recommend something and negotiate. Sometimes, like we said, we don't always have everything for each patient, but find a way to negotiate the treatment that we can give them that they'll be happy with and that you can feel good about.
Can you tell that story that you were telling me about that older gentleman? Just that he appeared to be in pain, but was not, but was saying he wasn't.
Yes, I did tell you about that. Sorry. I was like, which story?
I was like, without telling the story.
No, that's okay. I don't know how we were on that topic, but Aaron and I were talking, and I was explaining that culturally people are different, and meaning for example, what I know about Black men. Black men are raised not to show any pain, not to show any fear. They are taught within their families that they are the men and that they carry a lot of burden for us. So we had a gentleman in the ICU, and she was trying to control the patient's pain. She was trying to take care of the patient, but long story short, the patient kept saying he's not in pain. But then she was like, I don't know why his heart rate is going up, and his heart rate was in the 120s. And I asked her, I was like, well, what was his norm? And she's like, he's usually 80, 90. So I was like, did you ask him if he's in pain? And she's like, yeah. And he said he doesn't want anything. I was like, I don't believe him. He won't tell you that. He's not going to tell you he's in pain for several reasons. One, like I said, African-American males were taught not to show pain. Two, there's the long rabbit hole. I'm not going to go down the whole road, but there's a lot of mistrust with African-Americans in medical care because we have been abused with it before. So a lot of times they will not speak about things that they want or need while they're getting medical treatment because they're afraid that they will be harmed. And three, it's just sometimes you don't want to be accused of asking for pain meds and being treated differently and thinking that you are a seeker. So in the end, I told her, I said, just give him a little bit. You don't have to give him the whole dose. Just give him a little bit and see what happens. And sure enough, when she gave him some of the pain meds, his heart rate came down. He looked less sweaty. He looked more comfortable. And then she goes, oh my goodness, why wouldn't he tell me? I said, again, it's a cultural thing. And it's not just African-American men. I know a lot of Hispanic men are like that as well. They will not tell you how much pain they're in. They will sit there and suffer in silence. They will not tell you unless you're a close loved one. So pay attention to your body, and you'll learn this if you're in school, if you're a student on here and you're learning, you will learn how to look at not don't just always rely on your patient saying their pain. Look at what they look like. Are they sweating? Is their heart rate? Yeah, all your vitals. Like, look at everything. Does anything look different? Has anything changed? Go in the history. There are things that, like I said, this is why we brought this up. Culturally, there's a lot more about individuals that we do not, like a lot of people do not know, and we need to know, because how can we give the best care if we're uneducated on what is the differences in each individual and where they come from and how they're raised and what their morals are. We need to learn about each other so we can take care of each other better. This year should have shown everybody that we need to listen, because people get sick fast and we can lose them very quickly. So we have to pay attention. So this is why Kristine and I wanted to do this, because this is important. We want to, be good at what we do. I mean, it's a lot of work being here. I went through the same program, so I know it's not easy. You wanna do well and get out there and be a great nurse. So this is how you do it, listening.
All right.
We can open the floor for questions.
So I'm gonna stop sharing for a hot second just so I can see people and navigate really quickly. Terry, are you still on here? I don't know if she is or not. Hey, Terry.
I am. Yes.
Where are you? So I would like to introduce Terry Howard. So she's newer to Herzing, and I'm going to kind of let her tell you a little bit about herself and her role here.
Well, first of all, before I introduce myself, I just want to say what an awesome bit of knowledge that was dropped on all of us today. And if you aren't walking away with some piece of information, shame on you. So thank you very much for presenting the information today. I am Terry Howard. By way of introduction, I serve as the Associate Vice President of Diversity, Equity, and Inclusion for Herzing. New position. I've been around for 2 months, but I'm very happy to be here and so honored to be a part of the presentation today, because this is what we're talking about when we talk about diversity, equity, and inclusion. So if you can take a little bit of what you heard today and apply it to what you do day to day after you leave Herzing, that certainly will meet one of my requirements right away. So thank you very much for your time and energy that you put into creating the presentation. As you know, Erin and her team have been working on a series of sessions over the course of the next month that have to do with diversity in care. And as you've just heard for the last 45 minutes or so, this was specific to hair and skin, but as we go throughout the month, you'll be hearing diversity of healthcare, and it's not just about people, but practices as well. So hope you will continue to engage with us in the next couple of seminars that will be presented. I'll turn it back over to you because I'm sure you have questions and comments, and from someone who wears protective hair and does not allow people to touch my hair regardless if I was on a gurney or not. I appreciate the information again. So thank you so much for your time today.
Thank you.
All right, so I see the chat is lighting up a little bit. A lot of it with praise, just so you know, it's saying amazing presentation, that this should be mandatory for all nursing students to take. Does anyone have any questions specifically for Kristine or Jamice at this time?
I have a question. I'm wondering when, especially as a white, very ignorant to this female, when we're asking questions of our patients and of our colleagues and friends, how, and I don't know if there's an answer to this, how do we go about educating ourselves without putting the burden on people of color to educate us on our own ignorance? Because I think there can be a fine line, and I don't always want to be pulling people of color to tell me everything that really I should be learning. And obviously there's going to be times where, you know, a quick answer is needed, but I think, I don't know, I feel like it's worth bringing up that I don't want to put a burden.
That's a great question. Honestly, to kind of add to that, so Kristine, I told her, because I just wanted to see. I just wanted to see, because I know from my own self and learning things. I said, Kristine, see what you can find while we put this presentation together. Because we had put this together early last year. Was it early last year? Early last year. Yeah. So when I was like, go ahead and look up some stuff. Let me know what you can find. And everything she found was so old. And when I say old, they were still using inappropriate words to describe us as people.
There was almost no research on, I mean, there's lots of research on hair. If you just want to learn about hair, you can read about hair all day long. But as soon as I put in Black hair, African-American hair, you know, there was nothing. There was nothing. There's no research. There's the way that I got most of my education, besides talking to Jamice, I actually did the YouTube, and there were some people trending on there that were so fascinating. And I just sat there for hours looking at this going, I had no idea. I always thought you like glued the hair onto the ends of your hair. I had no, there was just so many different ways of applying it and so many products. And I was actually amazed at my ignorance and how little I actually understood and knew. And I always thought that everyone wore the scarf to keep grease from your hair to get on things. I had no idea. I had no idea. I mean, I've been a nurse for a really long time, and I've taught nursing school and I've taught CNAs, and I really was so amazed by how little I actually understood. So this has been a really good learning experience for me as well.
But I think to answer your question, Natalie, you were trying to ask, how do you find out without trying to not trying to make yourself sound as if that you're being racially biased, right?
Correct. Or just put that pressure on the people of color that it's their job to educate me for being ignorant. I don't want to put the responsibility on people of color.
No, just what you just said, all you have to do is start the conversation off by saying, I'm ignorant to this, but can you please elaborate more? We never get offended about it whatsoever. And I think that's the problem with America. We are so sensitive with this racial divide thing, to where people are always stepping on pins and needles, afraid that they're going to offend the other person, when all you have to do is just be professional, for number one, and just let them know I'm ignorant to it. So can you please explain to me? I've done it. I've worked for a Jewish family before, and I had no clue about a kosher kitchen until it was time to prepare a meal. Then I'm wondering why they're breaking down the whole kitchen, washing everything down, sanitizing, because I have taken the red to the blue room. So, I mean, it's just, you know, you just have to ask, that's all.
Usually, also when, with some people, what you want to do is actually just ask, what is their normal routine at home? That way you're not asking for culture, but you're asking what is the care for this specific patient. Usually everybody has a different routine at home anyway, and you will find out what kind of culture or routine that they have at home. That way you're not asking what is your normal culture routine, but most likely what are they doing at home different than any other people.
And when you do ask, like he said, professionally, like I said, Kristine and I went through this. So when she had questions, that's why she went to YouTube. I was like, oh, you'll be amazed. There's all these things on YouTube. I'm like, that's how a lot of the younger generation is educating themselves right now. They didn't go like we did and looking for books down an aisle and it was based on letters and numbers. They're using the computer and they're which is not necessarily a bad thing. They're using it and they're giving themselves platforms so that you can educate yourselves. It makes it more personal. So when you don't know, you may not know the best place to go, you know? So when you do go to your colleague and ask them, like he said, as long as you're professional, I would be happy to say, like, if you want to see more ideas, if you want to learn more, I would show you some of the people that I enjoy watching that's on YouTube. So that way you can sit and watch. And like she said, you'll be fascinated at, there's things that you guys do with your hair. And I'm like, oh, how you guys add extensions is extremely different to me. I'm like, they melt that on their hair? Like that's different to me because we're culturally different, but that's okay. But at least I learned, you know, how you guys care for your hair, and there's nothing wrong with that. That's how we get to know each other. This is how we can keep the kumbaya, because we learn to be around each other and learn different things, and that's how we have conversations. That's how we're having conversations here, asking each other questions. Never be afraid to ask, and you'll always run into someone that's rude, and if they're rude, move on to the next person. Just go, okay, thank you, and then go ask the next person. Never be afraid to ask, as long as, like he said, it's how you come with your question. It's not always the content, it's how we present the content. And so as long as you present yourself nicely, I don't think anybody, I don't care what culture, should be that upset with you asking. I definitely don't take offense when someone asks me. It's how they ask me when I get offended. That's it, when I'm a little apprehensive to talk to you about it, because then I feel that you're not asking me because you want to educate me, you're just being condescending. So, and people can tell the difference. Definitely know the difference, but thank you for the question.
So Clarissa's got her hand raised right now for, I'm assuming, a question.
Hello, everyone. I feel like an intruder because I didn't realize this was for Herzing students.
Oh, it's not. It was for Herzing students and open to the public too, so you're fine.
Okay, because what did I say? I saw it on Facebook, and so I'm a nurse practitioner. I worked as a nurse for over 8 years, and it's so, I just love what you guys are doing because it's so important. And I'm a DMP student, and my project is discussing racial biases and cultural competence. So that's what drew me to this Zoom. So I said, oh, this is interesting. I want to see what they have to say. And I'm just so glad that you are using this platform to educate your nursing students early while they're still learning, while, I don't know what level, the students may be, whether it's the beginning level, the first year, first semester, but I think it's so important. And I'm just so happy that your college is doing this because it's important. If we don't understand each other, if we don't, and I mentioned on here cultural humility, and it's like, as healthcare providers, healthcare workers, it's so important for us to have that that cultural competence and that rapport with our patients, for them to listen to us, for them to allow us to care for them to trust us. And I don't know. I'm so amazed by this because I've never heard of this happening at a nursing school. So I'm just so excited. So I'm going to go back to my my college and say, hey, are you guys doing this? Because this is so important. And I'm just amazed. I don't know. I can keep saying this a million times because I am just so excited. And I'm so happy that you guys are taking the time to do this. I am just going to keep rambling on, but I'm just excited. Thank you.
I always think, since this topic has come up, I think about, if my patient doesn't trust me to take care of their most basic of need, how can they trust me to take care of something more important and my complex medical needs? I mean, that's
absolutely
to be kind of scary, for them to think that she doesn't even know my basic needs.
Absolutely.
So yeah.
Thank you. Great work.
Thank you.
And Professor Haggarty, I have to tip my hat off to you for even like being bold enough, let me say, to even, to let us know that you were truly incompetent of the whole situation. Like,
I'm not afraid for people to know that I'm truly human.
No, I'm just saying that because, we think professors know everything. So so it was just good to know that you don't.
No, we don't. We're very human.
Yeah.
No, she is a very great person. I feel like if anybody that was perfect to work with, this was the perfect person for me to work with this project. Yes. As if you know anything about Professor Haggarty, she is a wonderful person to be around.
Oh, we've had enough tonight, so thank you for coming.
She's very warm, very humble. And that's the thing, as long as you come with that energy, and you have your heart open, it is so, you just become a sponge. And that's the thing. We did this originally for another platform for Herzing. And even past that, she'll send me stuff like, did you see this? Did you see this? And I'm like, yes. And I'm like, and I'll send her things. And I'm like, wow, I'm like, look at this. And we still send each other things like after the fact. And so when we decided to open this up more to the students, because I think we did it for just the faculty the last time, well, that was like amazing. I was like, this is who we wanted to reach first is our students, because that's who's learning that. You guys are the ones that are going to be taking care of us. And I want you to know how to take care of me correctly. You know, I don't want to be out there and I wake up. I don't know if you all have talking to patients that have been in the hospital, but there are people that are not Black that have woken up because of poor hair care, and they've had to cut their hair because it's been matted and natted and not touched. That is horrifying. If you're not ready to put scissors to your hair, you already went through something traumatic for your health. And to get up and be told, like, guess what? We can't get this out of your hair. Now we have to chop it off. No, I wouldn't want to wake up. I would be very upset. And so, like she said, the most basic thing, this is something so easy that everyone can learn. So that's why we thought this was great that you guys were opening up, Herzing decided to open up to the students, because you guys are the ones that are going to matter, that need to know this information, because you're the ones that are going to be touching the patients. And there's, like I said, there's still that I learn. I love working in ICU. I see all kinds of different cultures, and I absolutely love learning from everyone, because that's how that's how you keep the love and passion of what you do. When you know someone and you know what they really like, then you put a lot of effort in what you're doing.
Yeah, I think it's something that's long overdue, though. It really is. It's long overdue. And I really thank both of you I thank everybody who had something to do with it, because this is like so important, man. It really is. It truly is.
Well, I'm just thankful you guys took time out of your day. I know you're really busy in everything you're doing. So we just appreciate that you came.
Thank you.
Thank you, guys. And thank you so much, Jamice and Kristine. It was amazing, like I thought it would be.
Thank you.
We do have more future ones coming up, like we're talking about. I did put my contact information on the side. So if you have ideas, or a lot of people on this work currently in healthcare. So if you're experiencing a gap somewhere, let us know what some of your ideas are, or what some of your wants are for future learning sessions. And we will certainly try to make that a possibility. Our session next week on the 22nd is actually going to be on holistic medicine. So we have a gentleman coming in that has actually won awards about maintaining pain management for people that are, instead of using methadone, he used essential oils, and he wrote a dissertation on it. And so just some alternative ways that we can combine Western medicine with a holistic approach in medicine for a complete approach, to treatment for our patients. So hopefully you can join us with that. And those are open to Herzing students and the public, because we think that this is really important. And yeah, we hope we catch our students, but the people that graduated nursing school and would like a little bit more information about it are fully welcome to. All right.
Sandra asked if this is available on Facebook, like the sessions.
I know that if you registered for this, if you register for the sessions, we email out the recorded session afterwards. So as long as you register for them, even if you can't attend, you will at least get the recording for them.
Any other questions, guys?
Oh, and future ones, I'm sorry. So they're not on the university website. We can put them on we can see if we can put them on Canvas, to notify you guys on Canvas, and kind of send an announcement that way. Otherwise, yeah, we do a lot of promotion in the Facebook group, and I do know they did some emailing to your Herzing emails also.
I'm going to interject for half a second. All events will be posted also on Facebook. So if you're on any of the Facebook pages, you can register through there as well. So.
All right.
Sandra said she's not part of the university. Oh, just go on the Herzing Facebook page and you'll be able to find everything.
Most definitely. Did that answer your question, Sandra? I think the okay thanks was part of that. All right, perfect. All right, well, thank you so much. Everyone have an amazing night. Stay safe, be healthy, and we hope to see you in the future. Thanks
All
for
right,
joining us.
thank you.